Good evening and welcome to the Personal Assistance Services Council Town Hall, your options on CalMedi Connect. My name is Greg Thompson and I'm the Executive Director of the Personal Assistance Services Council, or LA County's public authority. Tonight we're very pleased to have Eileen Harper, the Executive Director of the Center for Healthcare Rights, Los Angeles County Agency, and they're responsible for educating people on Medicare, Medi-Cal, and about the new CalMedi Connect program. The Personal Assistance Services Council is the public authority for LA County. Some of the services that we provide are a registry referral service to assist consumers locating workers. We have a backup program for consumers who have an urgent need for a temporary replacement worker. We provide training for IHSS consumers and home care workers. And we administrate the health benefit plan for the IHSS home care workers. For information on any of our programs, you can visit our website at www.pascla.org. So let's go over a few tips for those of you that are new on our call. First, anytime during the call, if you'd like to ask a question, you simply press *3 on your phone and you'll be connected to a live screener. Second, we'll be asking several poll questions throughout the call, and you'll have an opportunity to answer those by pressing the number on your phone for the correct answer. And finally, we'll take several breaks during the call, and we'll have live questions and give those of you on the line an opportunity to speak directly to Eileen or myself. So let's get started with our first question. The first question is, are you comfortable making a decision about CalMedi Connect today? Yes, press 1. No, press 2. Again, that question is, are you comfortable making a decision about CalMedi Connect today? Yes, press 1. No, press 2. All right, so now I'd like to welcome Eileen Harper from the Center for Healthcare Rights. Eileen, it looks like over half our listeners have answered, and I'll update those when I get the actual numbers for question 1. So do you think you could tell us a little bit about what you do at the Center for Healthcare Rights and provide our listeners with basic information about how to make a decision on CalMedi Connect?
Okay, well, let me begin. And again, thank you, Greg, for inviting us to participate in this town hall. Gives us a great opportunity to talk to in-home supportive services consumers directly. So let me begin by just telling you a little bit about the organization that I work for. Center for Healthcare Rights, we're a nonprofit healthcare advocacy organization here in LA County. And we provide free Medicare education, counseling, and legal assistance to consumers who have Medicare. We also provide information and assistance relating to Medi-Cal, Medicare Part D, and other insurance as it relates to Medicare. In terms of providing our services, most people who access our services come to us by contacting our telephone hotline, which is available Monday through Friday, 9 to 5 p.m. When people call our office, they are scheduled for a telephone appointment, and they will speak with a counselor within the next day or two. If they prefer coming in person, they just need to let the receptionist know, and we can make an in-person appointment. Our services are funded both by government and private foundation grants. Our main source of funding is a program called HICAP, which is Health Insurance Counseling and Advocacy Program, which is a statewide program that provides Medicare assistance across the state. In terms of our telephone hotline services, we have about 14 staff who participate on our hotline who essentially provide one-on-one assistance through our telephone to consumers who call us. Now, with regard to CalMedi Connect, our agency for the past year or so has been trying to provide information not only through our telephone hotline, but also through community education programs throughout the county to help people better understand their CalMedi Connect options. So at this time, do you want me to sort of go forward and talk more specifically about the CalMedi Connect options that people have?
I think it's important to let people know that you guys have been in existence for a while, and CalMedi Connect is a new program.
That's right.
But you're also available to answer questions about other things, and we're certainly glad to hear you. What is your general sense so far about how people are feeling about CalMedi Connect?
Well, I think one of the things that I'm struck by is that the number of people with Medicare and Medi-Cal, and again, CalMedi Connect affects only people with Medicare and Medi-Cal, the number of folks who have Medicare and Medi-Cal who really are not aware of the program and the important changes that it's going to make in their Medicare and Medi-Cal benefits. So I would say that one of our goals is to try to work with as many organizations and folks in the community to try to improve our community awareness about CalMedi Connect so that consumers have a better understanding not only about how it's going to affect their Medicare and Medi-Cal, but essentially what their benefits and rights are under the program.
Sounds good. One of the things that our board feels very strongly about is getting the right information out to people. So we're so glad not only to have you on the call, and I failed to mention at the beginning that you're co-sponsoring this call for us, so we really appreciate that. So I think let's jump right in, and why don't you tell us a little bit about CalMedi Connect?
All right. Well, the CalMedi Connect program is part of the California Coordinated Care Initiative, and what the CalMedi Connect program is it's a demonstration project here in California. It affects people with Medicare and Medi-Cal who live in 7 counties, so it's not a statewide program. The 7 counties include Los Angeles County, and those people with Medicare and Medi-Cal who live in the 7 counties essentially will have 2 options. Either one, to voluntarily enroll into new CalMedi Connect plans, which will be Medicare, Medi-Cal plans, which will manage both their Medicare and Medi-Cal benefits within one plan, or they can decide to not participate in CalMedi Connect, keep their Medicare the way it is, but enroll into a Medi-Cal health plan. So those really are sort of the 2 fundamental choices that people will have, and we can sort of elaborate in our discussion in terms of how those choices work.
Wow. I mean, I've been studying this stuff for 2 years, and I'm still confused about this, and so I'm real interested to hear how our callers feel about it. Can you give your information again one more time, who people can call?
Sure. Let me give the 800 phone number for the callers. Our 800 phone number, which is available countywide, is 1-800-824-0780. And again, this is for everyone in LA County.
Thank you. So we're going to take a call or two. And Daryl, are you on the line?
Yes, I am.
Hi, Daryl. Welcome. Can you ask your question, please?
Yeah, I am currently Medicare, Medi-Cal, disabled, and I have to give up my Medi-Cal to one of the 2 plans that I got from Medi Connect. My question is, I want to keep my Medi-Cal the same as it's been forever. I've been on Medi-Cal forever. And I don't want to get into one of these plans where I'm losing benefits from the way Medi-Cal is right now. Which is the best plan out there for me to choose?
That's a great question. I don't think I can answer that. Eileen, you want to take a shot at it?
Well, Daryl, I think what you've identified is sort of the second option, which is to keep your Medicare the way it is, but to enroll into a Medi-Cal health plan. And there are 6 Medi-Cal plans available in LA County that includes LA Care, Care First, Blue Cross, Kaiser, HealthNet, and Molina. So I can't say that there is the best plan for you in terms of the best Medi-Cal plan. What I will say is that the Medi-Cal plan is only going to control your Medi-Cal benefits. It's not going to affect your ability to use your Medicare, so you can continue to see your doctors, go to the same hospitals you've been to before. So what the Medi-Cal plan is going to do is affect the Medi-Cal services that you receive. So I think that there's 6 plans to choose from. What you might want to do is if you have internet access, you can go directly to the plan website, LA Care or HealthNet, sort of look at their Medi-Cal section. But if you'd like, if there's any additional, questions you want to ask, as a follow-up, we can try to do that.
It's a great question. We have Ann on the line. Would you like to welcome Ann and ask her question, please?
Well, it wasn't a question. It was a terrible comment. We've gone through 3 HMO. The lady told me just recently, she came here, I can't get out, so I need a home doctor. She said they're just doing it to get you on a an HMO to help them, not you, because they're going to get you cheaper doctors, and you should stay on Medicare alone if you can, because you'll get your own doctors, and this is what you guys don't want. You don't want us going to a lot of doctors and spending a lot of money. You want us in a little box of 1 or 2 not good doctors. I've had 7 doctors, and they get money, and they don't do anything for me. They're not specialists. So I'm stuck here. I had an accident. I belong in Santa Barbara. I'm stuck in L.A., so, what can I do? Nothing. I'm frustrated.
I can understand that, and you're not alone, Ann. We've heard a lot of people who are concerned about the program and concerned about the change. I would just recommend that you try to look at each health plan individually and make a decision. And again, the goal of CalMedi Connect is to help coordinate the care and improve the care, and yes, it is also to make it a more cost-efficient program. We have Linda on the line. Linda, do you have a question for us?
Yes, I do. I plan to stay in the original Medicare, and I also have Medi-Cal, and I have QMB, excuse me, and I have access for my transportation. I don't want to affiliate at this time with the Medi-Cal plan. I'm not using any of their services, nor do I anticipate using any of them in the near future. So if I receive a paper, I'll check the box so that I'm opting out, but I want to know, what are you going to do to me if I don't pick a Medi-Cal plan?
Okay, well, Greg and I, we're not actually part of the CalMedi Connect program. We're talking as advocates about how you can better understand the program and understand that you don't have to participate in CalMedi Connect, that you can keep your Medicare the way it is. But I think what you brought up is an important issue, which is you can keep your Medicare, but you cannot stay with Medi-Cal fee-for-service. You do have to select a Medi-Cal plan. So when you get your enrollment form, you can indicate that you want to keep your Medicare, but you do have to select a Medi-Cal plan, or the state will assign you to one. So it's very important that you use the enrollment form to say what you want to do, but unfortunately, you have specific choices. One is to go into CalMedi Connect. The second one is to keep your Medicare, but to keep your Medicare, you have to select a Medi-Cal plan. If you don't do anything with that enrollment form, the state will assign you to a CalMedi Connect plan.
Well, if I'm not going to be using the Medi-Cal services unless 20, 30 years down the road I got to go into a nursing home, I guess it isn't going to matter then letting the state pick what Medi-Cal plan they want to put me in if I'm not going to be using it, right?
That's true. If you don't really use your Medi-Cal benefits right now, in-home supportive services is not going to really be controlled by the plans in 2014. So if the only thing is you're using is in-home supportive services and you're not using anything else, then it probably wouldn't make a difference in terms of what Medi-Cal plan the state assigns you to.
Thank you for your question. We're going to take one more. Sandra?
Hello?
Hi,
Yes?
Sandra. Would
Hello.
you like to ask your question?
Yes, I missed part of it because I was asking the questions. But I told a lady I'm currently enrolled with HealthNet and Medi-Cal Medicare. I was applying for, first of all, I need to know, are you going to send us paper so we can make a choice?
I'm going to let Eileen take that.
Yeah. Could I ask you a question?
Yes.
Okay, so you said that you're in HealthNet. Are you in the HealthNet Medicare plan?
HealthNet Medicare, yes. And I also have Medi-Cal, Special Needs Program.
Okay, so are you in the HealthNet Medicare Medi-Cal plan?
Yes.
Okay, all right. So what will happen is that you will not be affected by this until early in 2015. So when you get your information from the state, when you get your notices and the enrollment form, that's when you will need to make a decision about whether you want to stay in your current HealthNet plan or whether you want to move to a HealthNet CalMedi Connect plan. So HealthNet is actually going to have a CalMedi Connect plan. So one choice for you would be to move from what you have right now, which is a HealthNet Medicare plan, to a different CalMedi Connect, to a CalMedi Connect plan, or to return to original Medicare and have a Medi-Cal plan. Do you follow? Do you sort of follow the sort of decisions, the opportunities that you have? So you could stay if you wanted to. You can stay in your current plan. That's one option. But you have to be in a Medi-Cal plan in addition to that, or you could move from your current HealthNet Medicare plan to a new CalMedi Connect plan.
Thanks for your question. I want to ask our second poll question. There's about 1,800 people on our call, so I expect you all to answer. And I want to give a special shout-out to a friend of mine, Jane, who I think is on the call, and let her know that we miss her. Here's our second question. To continue receiving IHSS benefits, I must choose a Medi-Cal managed care plan. True, press 1. False, press 2. Again, the question is, to continue receiving IHSS benefits, I must choose a Medi-Cal managed care plan. True is 1, false is 2. Okay, thank you. I had a couple of questions about the Medi-Cal plan, and now that if people do enroll in CalMedi Connect for both Medicare and Medi-Cal, how will that affect their share of costs? Will that change anything?
Okay, well that's a really good question. Okay, so essentially people who have a Medi-Cal share of cost, who are getting in-home supportive services, are eligible for CalMedi Connect, because the assumption would be that they meet that share of cost every month. So if someone has in-home supportive services and meets that share of cost every month, then they would be eligible for CalMedi Connect. If someone has in-home supportive services and never meets their share of cost, then they would not be eligible for CalMedi Connect.
And the other thing that I'm curious about is there's a lot of talk about value-added services and things that benefits that people might have if they join a managed care plan. Do you have any thoughts on that?
Well, I mean, I think what the state is looking at, and also the federal government as well, because this is a demonstration project, is they're hoping that by encouraging people with Medicare and Medi-Cal into CalMedi Connect plans, that people will get a higher quality level of medical care, that essentially they'll have a primary care doctor who will help them manage both their Medicare and Medi-Cal benefits, that their use of specialty services will be managed and coordinated. They will have access to care management services, and they'll also get some added benefits like a vision care benefit and additional transportation services. But I think the goal is to try to, by managing both benefits in a more coordinated way, the state and the federal government are hoping that the quality of care will improve.
And you mentioned a little bit about the specialty services. And another thing, there's been a lot of talk and a lot of work put into what they're calling continuity of care.
That's correct.
I understand what that is, but I'm not sure the people on our call understand that. Can you talk a little bit about what that means?
Yeah, I mean, essentially someone who enrolls into a CalMedi Connect plan will have access to what the state is calling continuity of care. And what this means is that during their transition as new members into CalMedi Connect, they would have access to their doctors who are Medicare doctors, who are not plan doctors, for a period of time. However, in order for that to happen, certain things have to take place. So, for example, if I'm a new CalMedi Connect member and I want to continue seeing my Medicare doctor, I have to contact my plan. My Medicare doctor has to agree on a reimbursement rate with my new CalMedi Connect plan, and then my doctor can provide medical services to me for up to 6 months. So the idea is not that your Medicare doctor continues to providing services forever, but only while you're sort of getting used to the new plan.
Okay. And again, if you have questions, you can get Eileen at 1-800-824-0780. I know I'd be calling them a lot because I'm still confused. If you want to ask a question, please hit *3 at any time. And I think we might take 1 or 2 questions if we have anybody ready. Joyce, are you on the line? Hi, Joyce.
Hi, thank you for taking my call. I am confused a little. I'm under CalMedi already. I have Care First for my Medicare and Medi-Cal, okay? And I also have in-home support system, services. Now, I'm confused what's going to happen in 2015. Do I need to do something, fill out more forms to reinstate, or I'm not clear on what I need to do?
Great question.
Okay, well, you're not in a CalMedi Connect plan yet. I think that sounds like what you're in. It sounds like you're in a Medicare Advantage plan for people with both Medicare and Medi-Cal. So I know this sounds confusing because, we're talking about a lot of different types of plans. So right now, you're in a Medicare plan for people with Medicare, Medi-Cal. So when you start getting your information about CalMedi Connect, and you'll probably get your information in the fall, at that time you can decide whether you want to stay with your Care First plan or whether you want to change to the Care First CalMedi Connect plan. If you want to stay with your current plan, you would fill out the enrollment form saying that you want to stay with your current coverage, but you would select a Medi-Cal plan. Now, alternatively, you could go from your current Care First plan to the new Care First CalMedi Connect plan. I know that sounds confusing, but that's a choice you could make as well.
I'm going to take one more question, and then we'll kind of dig deeper into how you're going to be notified for all of these decisions and choices you're going to have to make. Sandra, are you on the line?
Yes, I still didn't get it straight. If I stay with my HealthNet plan, Medi-Cal, Medicare, special needs, do I get to keep my IHSS plan if I don't sign up with CalMedi Connect?
You would get to keep your in-home supportive services, but you will also have to enroll into a separate Medi-Cal plan. I know that sounds really confusing. It doesn't make a lot of sense, but in order to stay in your current plan, you would also have to enroll. When you get your enrollment notice, you would have to indicate on that enrollment notice that you want to keep your current coverage, but you would also have to select a Medi-Cal plan.
And it's going to explain that further because I don't really understand that.
Well, you know what? You might want to give us a call. And again, for all of you, our 800 number is 1-800-824-0780.
Thank you, Sandra. Daniel, would you like to ask your question, please?
Okay.
Or was it Danielle?
It's Felicia Daniels.
Okay, I apologize. Please go ahead and ask your question.
Why am I still eligible for in-home service? I still have somebody still coming in, but I have to have it because I'm not able to stand up and walk and do my work.
Nothing is going to happen to your in-home supportive services. So whatever choice you make about CalMedi Connect, you will still keep your in-home supportive services.
All right, thank you. I'd like to ask our third poll question, if I could, and it is, I can opt out of my Medi-Cal benefits, press 1. Medicare benefits, press 2. Both, press 3. Again, the question is, I can opt out of my Medi-Cal benefits, press 1. Medicare benefits, press 2, or both, press 3. And now, while you're doing that, I'm going to give it back to Eileen. Eileen, one of the things that we've been spending a lot of time on as stakeholders, and we're very concerned, are all these notices that people are going to be getting and how they're going to be notified, and 90 days, 60 days, voluntary enrollment, passive enrollment. What are people going to do? So I was hoping you could kind of take us through the process and kind of give them some suggestions on, how they're supposed to, find their way through this process.
Well, as you say, Greg, it's really confusing for people because I think this topic is pretty complex and it's a little hard to understand. So essentially, the way the notification process is going to work is that 3 months before your targeted enrollment date, and everyone will have a targeted enrollment date for CalMedi Connect. Most people's targeted enrollment date will be generally their birthday month. So 3 months before their enrollment month, they will get notices. And as you said, they will get a notice 3 months before that enrollment month, and they'll get another notice 60 days before the enrollment month, and then 30 days. So essentially, each notice is going to tell them information about CalMedi Connect, their enrollment options, but essentially the notices will provide more information over time. So let's look at the 60-day notice. The 60-day notice is going to tell you that you've got to make an enrollment decision. It's going to tell you the CalMedi Connect plan that the state has chosen for you if you don't make a different decision, and it's going to outline again your enrollment choices. So again, the enrollment choices would be either 1, select a CalMedi Connect plan, or 2, keep your Medicare the way it is and enroll into a Medi-Cal plan. So when people get that 60-day notice, they'll also get an enrollment packet that includes their enrollment form. And I want to emphasize to everyone on the call today that when you get the enrollment form, if you need to fill it out, and if you don't feel comfortable filling it out, you should call our agency for assistance. Now, if someone does know what they want to do but prefers doing it by phone, they can also call Healthcare Options, which is the enrollment broker, and tell Healthcare Options what their enrollment choice is. So again, people will get 3 notices. All the notices will say CalMedi Connect, and they will come in blue envelopes.
That's probably my favorite thing that the state's done in this whole process of the blue envelope. So we're talking about 90-day notices, 60-day notices, 30-day notices. What about the voluntary notice in Los Angeles? Is that
right? Yeah, the state is actually sending out notices, but not to everyone. So only certain months, or only certain people with certain birthday months will get the voluntary notice. So people who have an October birthday will get a voluntary enrollment notice in April, and people with a November and December birthday will get a voluntary enrollment notice in May.
And the other thing that we get a lot of questions about, we talk about you can keep your Medicare services the same, or you can choose to join a health plan. What does Medicare cover, and what does Medi-Cal cover?
Okay, that's a good point. All right, well, your Medicare, for people who have Medicare and Medi-Cal, your Medicare covers your hospital services. It also covers when you are in a skilled nursing facility and need skilled care, covers home health. That's Medicare Part A. The Medicare Part B covers all your outpatient medical care. So all your doctor services are covered by Part B. And then your Medicare Part D is covering your prescription drug benefit. So your Medicare covers all your medical needs, so to speak, in terms of hospital services, physician services, and your prescriptions. The Medi-Cal benefit, what that covers is, again, in-home supportive services when someone is using Medi-Cal in a nursing home. In addition, Medi-Cal pays for incontinence supplies and medical transportation services. So those are essentially what the Medi-Cal end covers. In addition, Medi-Cal is the secondary payer to Medicare. So after Medicare is primary, then Medi-Cal pays the Medicare cost sharing.
Okay. Question on the notices again. So if my birthday is August, when will I get my 90-day notice?
Okay, if your birthday is in August, you will get your first notice in May, your second notice in June, and your last notice in July.
And I just had a thought. I don't have a choice with Medi-Cal. I have to choose a health plan.
That's right.
So maybe my efforts would be better spent looking at the Medicare coverage I have and the benefits and trying to decide if I want to go into a health plan or if I want to keep my existing services. Do you think that's a fair strategy?
Yeah, I mean, I think what we're telling folks is very similar to what you've just described. So if someone calls our office and they'll say, well, why would I want to join a CalMedi Connect plan? Well, one, if your doctors decide they want to participate in a CalMedi Connect plan, that would be a reason. Secondly, does the CalMedi Connect plan cover your prescription drugs? And thirdly, are you interested in those additional benefits like the vision and the transportation benefit? So generally, I think one main reason people are probably going to go with CalMedi Connect would be primarily if their doctors say that they are going to participate in a particular CalMedi Connect plan.
Now, in this myriad of notices that I'm going to receive, am I going to get anything about how to enroll, what my benefit choices are? I mean, what kind of tools will the state be sending us?
Well, the enrollment packet will have a booklet called a choice book, which provides general information on your enrollment options. But there won't be anything specifically about each plan. So there'll be 5 CalMedi Connect plans, but unfortunately, there won't be specific information on each particular plan. So, for example, there won't be a provider directory for each plan. There won't be a list of medications that the plans cover. So unfortunately, if people don't have internet access to go to the plan websites, they would probably call our office to try to get that information.
And before we take a couple more questions, the one thing that we hear all the time is how and when do I opt out? If I want to stay with my Medicare, how do I opt out?
Well, again, the enrollment form is really what you want to use to make your decision and to tell the state what you want to do. So, unfortunately, we haven't seen the enrollment form for LA County yet. It's still not available. But the enrollment forms for the other states generally have a top portion that says, this is the CalMedi Connect plan I want. So if you want CalMedi Connect, you fill that out. If you don't want CalMedi Connect, then you would fill out the other portion of the form, which basically identifies the Medi-Cal plan that you want. So again, it's very important that when people get the enrollment form, that they fill it out, send it in. If they feel uncomfortable with that, they can call Healthcare Options directly.
and they'll get the enrollment form again. What time? What notice?
They will get the enrollment packet at the 60-day mark.
The 60-day mark. Okay. Thank you. So let's hear more from you guys on the line. Chris, are you there? Could you ask your question, please?
Yeah, I'm here. Scenario, you got a procedure that needs to be done by Medicare, and the Medi-Cal plan's holding it up. What are we supposed to do?
Well, you know, the Medi-Cal plan is not supposed to be holding anything up relating to your Medicare. So if you have your Medicare coverage and you, let's say, are having a surgery, if your Medi-Cal plan attempts to do anything like that, you can either contact us for information and help, but there also is going to be an ombudsman program, a new program available to help people troubleshoot those types of problems.
And because people come on and off our call, can you give your number one more time, Eileen?
Sure. Okay, so the phone number for the Center for Healthcare Rights is 1-800-824-0780.
Okay, our next question's coming from Syra. I hope I pronounced that correctly.
It's Syra.
Syra. I knew I butchered it.
Syra, it's okay. It's okay. Thank you for taking my question. I also have Medicare, and my secondary is Medi-Cal. I have been disabled for 30 years, and when I became of age, when I turned 65, Medicare advised me to get Medi-Cal because of my condition and because of my low income. So I am very pleased with what Medicare has been giving me. And I am really confused with Medi-Cal. What is Medi-Cal going to give me? Is it still going to pay the 20% of, I don't know what the question is going to be, because the whole system I feel is confusing for my condition. Would I be getting transportation back and forth from the doctor's office? Will I be able to get a dental program with this new Cal MediConnect? Or do I keep my Medicare and Medi-Cal, or Medi-Cal is not going to be in existence anymore?
That's a lot of questions. I'll let Eileen start and then I'll fill in.
Okay, so let's start with the first question, which I think is an excellent question, which is, if you have Medicare and you enroll into a Medi-Cal plan, who pays your 20% copayment? If your doctors want to bill for the 20% copayment, if you are in a Medi-Cal plan, they have to bill your Medi-Cal plan. Okay? Now, the second thing that you brought up was transportation. Under Medi-Cal, you can get medical transportation. For example, if you are in a wheelchair and you need to go by van to for medical services. The dental benefit, Medi-Cal is bringing the dental benefit back as of May 1st. So everyone with Medicare, Medi-Cal who's an adult will now have the dental benefit back, but the dental benefit will not be a Cal MediConnect plan benefit or a Medi-Cal plan benefit. It's just going to be a regular Medi-Cal dental benefit, which you can use wherever you want, whatever dentist is a Medi-Cal provider.
And the question about, is Medi-Cal going to go away?
Well, Medi-Cal as fee-for-service is going away. So, yes, that is going to go away. So I think that, what we have right now is people who have both Medicare fee-for-service and Medi-Cal fee-for-service. So, yes, Medi-Cal as a fee-for-service benefit is going away, and it will only be available as a managed care benefit.
Okay, and again, we know you have lots of questions, and we're not going to get to everybody, so you can call Eileen's agency at 1-800-824-0780. And we have Layla on the line.
Hello.
Hi, welcome. Do you have a question for us?
Yes, please. I was born on April 23rd, 1949, and I haven't received any packet in the mail. I'm disabled for like 15 years ago.
Okay, well, you haven't received any information because your birthday is in April, so you're targeted for enrollment not until April 2015.
Oh,
so
good.
You will get information starting in January of 2015.
Oh, okay.
So you don't need to do anything right now.
Okay, so I don't have...
You don't need to make any decisions right now. You're fine for right now until 2015.
Thank you. Francine, are you on the line?
Hi, sure. Yeah, I am on the line. I have a couple of quick questions. I'll try and make them very quick. Number one, I don't quite understand if you opt out. At first, I was told if you opt out, you just get to keep your Medicare, and I didn't know what penalties there would be, but that nothing would happen to you. It's just that you would not be getting involved in the services of these 5 or 7 different groups that are doing the Medi-Cal substitutions. In other words, you could just keep your Medicare and the doctors that you have, and so you would have your Medicare A and D, and I guess the Medicare B is what would be blank. And what my doctor said, listen, they have to take people who have no money in hospitals, and they'd much rather they get a lot more money in getting Medicare A in the hospital than if they didn't get the 20%. They can bill you all you want, but all you have is your Social Security, and you have, you're a Medi-Cal person, or you were a Medi-Cal person, so they can't get any money from you. They still have to take care of you, especially if your doctor has to operate on you. But now...
Okay, sorry about that. But we're going to attempt to answer that question. Eileen, do you want to give it a shot?
Okay, well, I'm not really sure, what the last caller was describing. I mean, if you opt out, if you indicate on the enrollment form that you want to keep your Medicare, you have to select a Medi-Cal plan. Okay, so another option would be that you just don't have Medi-Cal anymore. So if someone just has Medicare, they can decide that they don't want Medi-Cal anymore as well. I mean, that actually is an option that people can do as well. But if people want to keep their Medi-Cal and they want to keep their Medicare the way it is, they have to assign their Medi-Cal to a Medi-Cal health plan.
Now, one thing I heard in that question, she was talking about her physician and physician's reimbursements.
Right.
And I think it was related to a physician who's not in one of the 5 health plans.
Right. Yeah, I mean, in order for the doctor to bill for his 20% copayment, he doesn't have to be part of the Medi-Cal plan. So in order for the doctor to bill for the 20% copayment, in order for the hospital to bill for the Medicare deductible, those Medicare providers do not have to have a contract with the Medi-Cal plan.
Okay, good answer. Thank you. Daryl, would you like to ask your question? Are you still on the line, Daryl?
Yeah, I'm here.
Great. Welcome. Could you ask us your question, please?
Yes, I was wondering in regards to the plans that are out there for Medi-Cal, if they're going to be much different from what original Medi-Cal is, and if I am already on Medicare, okay, because a lot of my doctors don't accept Medi-Cal. So if I'm on a Medi-Cal plan, would they, even though my doctor doesn't accept it, to get some kind of payment because I'm on a fixed income, what would happen then?
Well, let me ask you a question. Right now, you say that you see doctors that don't take Medi-Cal. Is that correct?
Most of them don't, right.
Okay, so if your doctor doesn't take Medi-Cal, then he's just waiving his Medicare cost sharing. He's just not charging anyone for your 20% copayment, and he can continue to do that once you're in a Medi-Cal plan. So it may not.
I want to keep my Medicare. It's called fee for service. I want to keep that. I don't want to give up my Medicare to an HMO.
No. Okay, you do not have to give up your Medicare. You can keep your Medicare the way it is, but in order to keep your Medicare the way it is, you have to assign your Medi-Cal to a Medi-Cal plan. So if your Medicare doctors are not even billing Medi-Cal now, they would probably not bill your Medi-Cal plan for your Medicare cost sharing. So it sounds like it's not going to really be any different from what's going on right now.
But the reason why I have to have Medi-Cal is because Medicare, even if it's not an HMO, has cut back and won't pay for durable equipment because I have polio, wear leg braces and special shoes and walk with crutches and all that.
Right.
Medi-Cal is still paying for my crutches, still paying for my orthopedic shoes, my leg braces, okay?
Right.
So that's why...
So once you're in the Medi-Cal plan, that medical equipment or those supplies would have to be billed to your Medi-Cal plan. So you would be getting those benefits not available under Medicare from your Medi-Cal plan.
Okay, thank you. I think we have Lily on the line. Would you like to ask her question for us, please?
I want to make certain I'm understanding about the blue envelopes that come out 90, 60, and 30 days. My birthday is in March. Am I correct? The first blue envelope I would get is December 2014?
No, it'd be yes. The first one would be December 2014 because your enrollment month is not until 2015.
Okay, I'm going to ask our fourth question, and then we'll get back and take a few more live questions. Okay, so here it goes. If I have a question, I can call the Center for Healthcare Rights, yes 1, no 2. Again, that question is, if I have a question, I can call the Center for Healthcare Rights, yes 1, no 2. And after you've answered that, Eileen, is there anyone else that they can call if they need some assistance?
They can call Healthcare Options. Healthcare Options, again, is the enrollment broker. So if they want to also contact Healthcare Options for information, they can contact Healthcare Options as well. Our agency has identified on the enrollment form, on the notices that they will get, but essentially I think the two lead agencies will be our agency as the HICAP organization and Healthcare Options.
And the number for Healthcare Options, apparently I'm getting the wrong number. I apologize
would you like
for this.
Okay, let me give you the number.
Thank you.
The phone number for Healthcare Options, and this is a specific phone number for people who want information on CalMedi Connect, is 1-844-580-7272. Repeat it. Okay, again, 1-844-580-7272.
Thank you. So do we have time for a couple more live questions? Let's go with Gloria. Hi, Gloria, are you there? All right, let's go for Maria. I'm sorry, they're flashing me signs and I can't always read them. Maria, are you there?
Yes.
Could you ask your question, please?
Yeah, I have a question. I want to keep my same plan that I have it, but you guys mentioned that if at medical I had to choose my plan, and you give it like a 7 different plans. What's the difference the one to another one? All of them is the same thing?
Great question.
Okay, so let me ask you, what is the plan that you have right now? What do you have right now?
I think we might have lost Gloria. Our recommendation is to look at all the plans. You can request information from them. Do you have anything else that you want to add to that?
Yeah, I mean, I think, many of the callers that called say that they have a plan right now. If they have a Medicare Advantage plan now, they will be able to stay in that Medicare Advantage plan, but they would also need to select a Medi-Cal plan when they get their enrollment notice. So, they can stay with what they have, again, because they have Medicare, but they can also think about making a change to a CalMediConnect plan instead.
And again, I think it's so important that you look at your current services, including the vendors, and if you want to stay with your doctors and vendors, then you need to find out what plans they are affiliated with and then choose those plans. Ernestine, are you there?
Yes,
Ernestine?
we're here. Hi.
Hi.
Yes,
Could
hi.
you ask us your question, please?
The question that we have is that we currently have Medicare, Medi-Cal, and we are with UCLA, because that's where all of our specialist doctors are. If we decide to keep the Medicare and, of course, the Medi-Cal in-home supportive services, which my question is, how do we find out how to keep what we currently have with UCLA doctors? We have to call UCLA and see if I don't think they're part of, like, the 6 Medi-Cal. I know they do United Healthcare. So how does that affect us if UCLA...
Well, what I would recommend is to ask your UCLA providers, are they going to participate in any CalMediConnect plan? Okay, so I think the key question you want to ask is, are you going to participate in any CalMediConnect plan? If they say no, we're not going to, then likely you probably are going to want to keep your Medicare the way it is, but you will have to select a Medi-Cal plan, and the Medi-Cal plan will not affect your Medicare benefits, but it will affect your Medi-Cal benefits.
Thank you. Our next question comes from Marlene Mays. Are you there?
Yes, Marceline.
Marceline, I screwed
That's
up another
okay.
one. I'm sorry.
That's a difficult name. Yes, my question was, are there going to be any classes that can educate people regarding each one of these plans? Because how can we make a choice that suits our own personal health problems?
Great question.
Yeah, that's a really good question. Our agency is doing a lot of education programs all over the county. So let me give you our 800 phone number again. It's 1-800-824-0780. And when you call, you can speak, we'll set up an appointment to speak with a counselor one-on-one so that you can describe your situation and the counselor can walk through the enrollment options with you by yourself.
And here at the Personal Assistance Services Council, We're also doing some outreach with what we call our consumer core and our peer mentors. And there's two things that we're looking for. One, if you're interested in getting involved in this process, either doing legislative visits or going out and running peer groups, you can give us a call or go to our website. And secondly, we're also offering classes similar to what Eileen is talking about, where we have people who are actually on IHSS and we're going to facilities and answering questions. And you can call us at 1-800-206-7000, or you can go to our webpage, www.pascla.org. We're going to take one more question from Priscilla. Hi, Priscilla.
Oh, hi. My question is, you mentioned there's 5 different Medi-Cal health plans, that we would pick one of those to be assigned to our Medi-Cal?
There actually are 6 Medi-Cal plans. There are 5 Cal MediConnect plans, but there are 6 Medi-Cal plans. So the 6 Medi-Cal plans are LA Care, Care First, Blue Cross, Kaiser, HealthNet, and Molina.
That's the 6th one. So for a Cal Medi...
for Cal MediConnect, there will be 5 plans.
What are those 5?
So the 5 Cal MediConnect plans are LA Care, Care More, Care First, Molina, HealthNet.
Thank you guys for all of your questions.
Thank you very much.
Thank you for your question. I know this is confusing. Hopefully we were able to make a little dent in all this confusion and information. I want to encourage you, number one, open those blue envelopes. I think that's the most important thing you can do. And then secondly, you can call the Center for Healthcare Rights, 1-800-824-8780. I got to repeat it again. I'm sorry. That's 800-824-0780. And again, thank you very much for your call, and we're going to be doing more of these, and we hope you'll join us. Good night.